Today we're going to learn how to irrigate the bladder with methylene blue. In the operating room we have Dana, who's just had her C-section, and the doctor says to me, we have to irrigate the bladder because I think I may have nicked it. So what you're going to do is you're going to go and pick up one bag of normal saline, some IV tubing, your methylene blue, a syringe, a needle to draw it up with. Now, the methylene blue is in a bottle today. Next week it may be in a vial. So if it's in a vial, of course, you are going to need to get a filter needle to draw it up with. Today we're just going to use a regular one. So we're going to first of all wash our hands. And there's a hard time going away. And then we're going to put on a pair of gloves. And the reason for the gloves is extremely important, other than the fact that you are in the operating room. If you get this stuff on you, it wears off. So I want you to make sure that you don't spill it on the floor or get it on you. So we open up our needle and pop off the lid, put some air in there and draw it up. Okay, you need to clean your port with an alcohol swab, always. Push the needle in, squirt the blue in. Don't recap the needle, put it in the sharps bucket and shake up your methylene blue. Now, attach your gravity tubing. And because there's a little blip of blue on there, I'm going to wipe it off because I don't want it on me. Spike your bag. Run it through. And you want your clamp close to where you can manage the clamp. So pull your clamp all the way down to the bottom and clamp your liquid off. Now, this you're going to give to the anesthesia nurse anesthetist. She's going to hang it on her IV pole, and then you are going to bury down underneath the patient's drape here, and you're going to find this little port right here. And again, you're going to clean it off. You're going to push that into that port and clamp it. Then the scrub tech is going to hand you, I only have a hemostat, but she's going to hand you a Kelly, and you're going to clamp the Foley right there, because the natural way for this stuff to go is straight into the bag. The game plan is to get it into the bladder. So you're going to clamp that nice and tightly, and then you're going to open up your drip, which I'm not going to do because the end of this Foley isn't attached to anything. And it will drip in, and the doctor will tell you when to stop. Usually it's about 300 cc's. And if there's a hole in the bladder, of course, what's going to happen is it's going to pool in the abdomen. After you're done, you reclamp the fluid. You take off the Kelly. You take it away with you and put it underneath the instrument cart, and then you undo your methylene blue, and if you've still got the cap, you can cap it so that you don't get a mess anywhere. And your job is done. Easy.